Hello and welcome to DIY Therapy. As always, we will start with our disclaimer. This podcast is for educational purposes only. It is not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professional prior to beginning. Information on this podcast is not designed to replace medical treatment. We have something a little bit different and special today. We had a friend who has re-injured her back. She has had back pain in the past, and she's wanted to talk with us about how to alleviate that back pain. And so we kind of recorded that conversation so people would have an idea of, if they signed up for a wellness consultation, what it would sound like and what they would get out of it, at least from the first one. I didn't talk very much this one. It's mostly just Andy going through the steps with her, and we'll just listen to that right here. Hi, Heather. It's Will.
Hello.
Yeah. I have Heather here. She's a friend of the podcast. She has injured her back. Yes?
Yes.
And we're going to kind of do a mock wellness consultation with Andy and her, so everyone can get a taste, an idea of what it would be like, how it would go, and if it would be appropriate for them. So I will give it away to Andy.
Yes, so thanks for joining us, Heather.
Yeah, thank you.
Yeah, so Heather and I actually know each other a few years back, and we keep in touch. And then she texted me a few days ago saying that she actually injured her back. So we thought it'd be a good opportunity to, and I don't know anything about her back pain at this point, but we thought this would be a great opportunity to actually kind of show some of our listeners our wellness consultation and what it can kind of do for them if they are having some back pain that they're not really sure how to manage, and also whether or not they have any type of pain that they don't know how to manage. This is really looking more or less at the process in which we kind of go through and look at different patients' triggers, different patients kind of basically what things kind of make them feel better, and then kind of help try to push them on their way to identifying those things and avoiding some of the agitating activities, and maybe even giving them some different exercises that will allow them to heal and get through their pain. So, Heather,
Yes.
what's going on?
So the original back pain started in April. I was landscaping and lifted a heavy bag of soil. 24 hours later, full extension into stand up straight, caused bilateral low back pain. I did the knee-jerk reaction, went to the chiropractor for several visits. He took x-rays and did manipulations, and within 2 weeks, I was back to no back pain, back to my regular activities of working out 4 to 5 times a week, lifting, all of that. And then about a week and a half ago, the pain started coming back. I don't know what caused it. I'm just doing my normal workout in the morning, do whatever on the weekends type of a thing. And it would come and go. Back in April, it was always constant. From the minute it started, from the onset, it was constant pain. A week ago, it was sporadic, depending on what I was doing. And then today's Thursday. Monday, it became constant. And then Tuesday was the worst, where I could sit, stand, lay down, ibuprofen, nothing would touch it. And it's not radiating at this point, but it's bilateral low back into, I would say it affects my hips, and just in the sense of, like, if the pain is sharp enough, my hips are uncomfortable, but I can get the pain. Now I can get the pain just to be sporadic, or I can get the pain basically down to zero with muscle relaxers and ibuprofen.
Okay.
And
So
ice.
are you doing any ice or anything either, Heather?
Yeah, I ice two times a day.
Legit 2 times a day?
Mhm.
Okay. Morning, afternoon, before you go to bed?
Usually in the mornings, and then sometimes in the afternoon, depending on when my workout is.
Okay.
And then before bed.
Okay. Let's talk about a little bit about what actually occurred when you injured your back way back when. You were lifting soil. Were you doing like a lot of yard work? Was it just one incident of lifting soil, or were you spending a lot of time out there?
I would say it was 2 to 3 hours outside, and it was lifting the soil or the bags of mulch. I mean, the soil was obviously the heaviest, and I didn't notice anything at the time. It's not like I felt my back give out on me, so to speak. Then it wasn't until 24 hours later where I was standing and realizing I had something wrong.
So in terms of your previous back pain, did you have any? I mean, I know again, you and I kind of know each other a little bit. I think you've had some back pain in the past, correct?
Yeah, I mean, I'm kind of, and this
Is
is
this
some,
different? Is this different than what it
yeah,
typically is?
yeah.
Yeah.
I can have some discomfort, and a lot of that would come low back into more of my SI joint. And I'm able to like self mobe and self manipulate that and pop it, and my pain goes away. And then when these episodes come on, so both in April and then now, I can't move my hip to where I can pop it, and therefore I think that so I can't relieve the pain.
So when you were saying popping, what were you actually doing
Um,
with
it
that?
was it was more of
What
like
is your definition of popping?
so like basically a manipulation. So I would stand up or lay down or whatever, and arch my back and basically tilt my hips forward, and I could get something in my right side lumbosacral area to adjust, or I mean there was a popping sound, so that's my
Okay.
definition of a
And then you got
popping.
instant relief after that.
Usually, yeah.
Okay.
Um, and you like prior to April, it was all very minor in comparison to now in April of like the constant back pain, sit, stand, whatever.
hmm So when you were having some of the incidences in right after the April incident, what was the most dramatic, what was most painful types of activities at that point? Because you keep kind of mentioning that you have constant pain, right? But the
Mm-hmm.
pain, let me make sure that I'm clear on this. The pain, even throughout the day, though, would still vary, correct? Like, so it wasn't like, hey, it's always at a 1 out of or an 8 out of
Yeah,
10 pain. Sometimes it's at an 8 out of 10 pain. Yes, it's constant throughout the entire day, but maybe it could also drop down to say like a 4 out of 10 pain. I'm assuming, right?
mm-hmm.
And so that's an assumption I'm making. Is that correct?
Yeah.
Okay,
I would
so
say,
I'm sorry, you're cutting it.
can you hear me?
Yeah, there you go.
All right. I would say um, to get to full, like if I had to go from sit to stand to get to that full and like standing position, that was always the worst of like
Okay.
no matter when.
So
And then,
transitioning.
yeah, that was, and I would say even now when my pain is a lot less, that still can get me. I can do it in a smooth motion, whereas like Tuesday I had to do it in about, it took me a little bit. Um, but I can usually laying, like supine position takes away all of the pain, or at least reclined position, unless it's really bad. But
Okay. And so again, going back to when you originally injured yourself in April and prior to seeing the chiropractor, how much time was in between you seeing the chiropractor and the original injury in April? Did you go right
five,
away?
5 days, six, I think it was
Five.
5 days.
Okay, so during that 5 days, again, with that variance of pain, again, you're in constant pain the entire time. Did you have a go-to position that still felt better than something else? Did you have positions that you specifically knew you wanted to avoid because if you did those types of things, you'd automatically have pain?
I mean, I was on the couch a lot of those 5 days. Like I had to take time off work, and I sit at a desk for work, and so that, I mean, it's not like I have an active job. Um, so yeah, I was on the couch for at least 3 of those days, and
What position?
anything like
Like when you say
I
you're on the
mean,
couch,
basically, I was supine, but I was reclined, like a reclined supine. So like
so like a
laying,
45-degree angle type of.
yeah, laying down but not flat.
Okay. And
Um,
then did you do that because that felt better, or did you do that because?
yes, I did that because that was the only way I could get relief enough to
Okay.
quote unquote function, even though I wasn't.
And at that point in time, when you were getting relief from that pain, do you recall what you were actually experiencing? Were you experiencing pain that was more into the hips at that point, or was it more centered to the low back? What would you say there?
I would say that was more centered to the low back on that episode. This one was, I guess it is radiating, but it's not the same type of pain. It's just more,
Okay.
but yeah, in April, it was centralized to low back.
Okay. And so then you went to the chiropractor. How many sessions did you have?
I believe I had 4 or 5 sessions.
4 to 5 sessions. Okay. And that was over the course of what, like a 2-week period?
2
Longer?
to 3 weeks. Yeah.
3 period. Okay.
Yeah.
And then so that resolved it. What? 100%, 20%, 80%.
I thought 100 at the time.
Okay, so you felt pretty darn good.
Yeah, I mean, I was back to doing my normal workouts and running if I wanted to, and all that. And then it just kind of, yeah. But obviously, it didn't fully resolve it because here I am.
Okay, so in between then, you did not return to complete normal activity then? You stayed away from your workouts, or did I mishear you there?
No, I went back to my
Okay, you did go
workout.
back.
Yeah.
Okay.
Yeah,
All right,
but
so
last week at the chiropractor, I was doing my normal routine.
Okay, cool. All right, so outside of, so now when we take a look at this next incident that you just had in the last 2 weeks or so, right? What changes or what kind of, was there anything that happened during that time period that you can kind of put your finger on that maybe brought on your symptoms, that maybe agitated it?
I mean, there were certain workouts I would do that I'd notice it more, but usually not a constant thing. Like I would feel more sore after a workout than like oh, this hurts, like I have back pain. Until, like I said, until Monday, so until 4 days ago, then I was like, whatever I did during my workout, about 2 hours later, I was like, oh shoot, I actually like can't get out of this time.
Sure. So going back to those certain things prior to it getting, really bad, what was it what were the other workouts that you kind of said, oh, these don't feel quite right? Do you recall?
I would say anything with, I don't know, a lot of tension on the back. So whether it was like planks or like any squats or anything, like I was fine with all of that if I watched my form and I did it right. But it would be anything with extra tension on the low back. But for the most part, I'd stop what I was doing or it would go away.
And then are you also running, walking, doing any of those types of things on an incline or anything like that?
No, I haven't. And it's not because of back pain. I just haven't been able to get out and run.
Are you not running anymore?
No.
Oh, I didn't know that.
Well, I would like to, but it's either raining or 95 degrees outside when I get off work. And yeah. So
not happening, huh?
I'm not doing it in 95 degrees.
Okay. So after things then went sideways again here, and now everything hurts, what is it are you doing anything at this point besides muscle relaxers? You said you were taking some ibuprofen, you're icing, or is there any specific exercise that really, or position of the spine that you feel better in? Is there anything that, again, makes you feel more aggravated at this point?
Again, like today, I'm probably sitting here. I'm probably only in a 1 to 2. Like I noticed it, but it's not nothing. It's not anything like Tuesday was, or even yesterday. So like I can go from sit to stand fairly quickly without much pain. But I'd say anything that still requires like squatting or like, I'm very hesitant to bend over and pick something off the floor right now just because of the pain.
Okay. But yet, so just a little for the audience here, we are Skyping via video also. And so what kind of position are you sitting in right now?
I'm because I know better, but I like to be comfortable. So I'm on my couch and I am in a slightly forward flexed position with my left leg tucked underneath me.
Crisscross applesauce?
My right leg's on the floor.
Oh, good.
Yeah.
Good. Okay.
Corrected myself 50%.
All right. And so let's just recap too. In terms of like your extracurricular activity, you do a lot of, again, I know a little bit about Heather. It works an administrative job. How much sitting are you doing throughout the day?
A lot.
Yeah.
And so that can get uncomfortable. By middle of the afternoon, I'm needing to kind of stand up and walk and just stretch it out a little bit. But yeah, so I would say on a normal day, I'm doing, this past week, 8 to 10 hours of sitting a day.
So how's your ergonomics?
They're fairly okay. I would say it's not super comfortable to sit ergonomically correct. So I don't. But
So in what way is it not comfortable to sit? Like why do you say it's not comfortable to sit?
I would say it could be partially because of the way my desk is set up, but I would say just because of working on a laptop. I don't know, maybe I'm off on this, but like working on a laptop rather than like a desktop induces that forward flex position no matter like what type of chair or anything you have, just because and then I have a second screen to my right that if I'm not looking at two screens, I'm looking at three throughout the day. So that would be the issue of like, I just find myself in that forward flex position and I could correct it. It's just not as comfortable and not as conducive to work, if that makes sense.
No, it does. That's fairly common. Any X-rays or anything like that you've ever had? Any different diagnostic tests?
In April, I had X-rays, and I I had X-rays in April, and through the chiropractor, and it showed an increased curvature, both like an extension curvature and then a lateral curvature in my low back.
Okay.
But nothing. I mean, the chiropractor wasn't overly concerned about it, but he did kind of associate that to you might have. It wouldn't be uncommon for you to have back issues, but it's nothing major.
So, is your pain more left-sided, right-sided?
It's pretty well bilateral.
Okay.
Yeah.
Doesn't shift one way or the other at work or anything like that either?
No. And if it does, I can't pinpoint what way I mean, if it shifts one way, I correct my position and it goes back. And so, yeah, I would say for the most part, it's pretty much dead center. I mean,
Does it
kind of
radiate out?
like,
I'm sorry, I didn't mean to interrupt you.
No, you're good. If I get really uncomfortable, yes, it will radiate out. But it's a different kind of pain. So, like, in my back, it's a sharp, like, I described Tuesday as like my bones were on top of each other and I just needed somebody to pull me apart. But yeah, then I don't know if it's just because of the amount of pain I was in and the tension that then like just kind of my lateral low back and my hips felt sore more. It wasn't like they were in pain, but I'm sure I was holding myself, like my position was different because of my pain and that could have increased the soreness too.
So tell me a little bit about how you spend your day, and not only when you're in pain, but like even that moment before the pain came back. Tell me a little bit about like how you spend your time not at work. Are you sitting a lot then? Are you sitting on the couch? Are you sitting in a recliner? What kind of chair are you sitting in? How much time are we spending there?
Yeah, it totally depends on the day.
Yeah.
I mean, I usually try to get my workout in the morning. So then, like by evening when I get home, if I don't have anything going on, which is rare, I'll go to the couch or a comfortable chair and put my feet like on a footstool, an ottoman. But usually I have something going on where I would be sitting in a harder chair or kind of the same type of either hard chair or another office chair throughout the evening. But
Mm-hmm. Okay. And you kind of mentioned earlier that your pain somewhat gets worse throughout the day. Is that correct?
If I'm sitting a lot, yeah.
Yeah.
You
Okay.
know, if I'm
And then how do you feel directly in the morning, right when you get up?
the past 2 morning, like this morning, I didn't have any pain when
Okay,
I
good.
got up. But like I was uncomfortable then after about an hour or a half hour of standing, but I could relieve it fairly quickly. So mornings are
Doing
my
what?
best.
You said you
What?
could relieve it fairly quickly. Doing what?
Sitting.
Sitting.
So like I would stand up, and make breakfast and whatever, get ready for the day, and then if I'd sit down, I went back down to a 0 or a 1.
Okay. All right.
That was this morning, but
Okay. And so, all right. So as we start looking at, your pain, part of the process of this is just kind of getting to know your story, and getting to understand, and really the goal of like all of these consultations, are to really kind of take you through a self journey in terms of trying to recognize what it is that, your unique situations, your unique variables are actually driving, how they're driving your symptoms. You're somewhat interesting. Can I say your age, Heather? Do you mind?
yeah, no, that's fine.
You're 28. We also had Heather fill out just a quick little survey prior to this, which is kind of some of the same information we just kind of talked about. So there's a little bit of information I should say that I did know, but just from a survey that we send out. Um, but part of this is kind of going through a whole self-discovery and having a better understanding of this. So when we look at your pain, and really how your pain has progressed over the last, from when it originally injured in April, you really hurt yourself being more in a flex bent forward position, correct?
Hmm.
Okay.
Hmm.
A lot of lifting, a lot of bending. You still feel very hesitant in terms of listening to your story. You still feel very hesitant in terms of bending forward, correct?
Hmm. Yeah.
Like if you were to reach out and touch your toes, how would that feel? Would you be scared to do that?
Um. Yeah. I
How
mean,
about if
not
you
that
were to
I.
reach? How about if you were to reach down, touch your toes, and pick up like just something simple like a gallon of milk? Would that
Yeah.
be would that be
Yeah.
even scarier?
Yeah. And there would be time like certain positions of going. It would be the initial. I would say like once I got past. I can't really have been past 90 degrees. Let's be real. I don't have that hamstring length. But once I would get past like that 90 degrees, it would be fine. But it's that like initial and then the coming back up into extension, I would say.
Okay, so still that extension. Yeah, so there's a couple things that I think are interesting. Once you originally got a little bit better, and some of the tone changes that usually happen with a chiropractic treatment really kind of lessen some of the muscle spasms, muscle tones. You seem to do a little bit better, right?
Hmm.
But did you do anything after that, to help kind of keep those symptoms away? Did you do any strengthening? Did you do any other specific exercises to try to keep those symptoms away at that moment in time, or did you just kind of say, oh, kind of wash your hands of it and say, well, that was fun. We're healed and we're going to just get back into the normal routine? Or did the
Yeah.
chiropractor give you anything special to do?
He didn't give me anything special. And that was kind of where my own fault was. I should have just specifically done some core or whatever I do, and like my workout programs and stuff that I do. 4 out of 5 of them a week have core components to them.
Mm-hmm.
Um, but yet that's not necessarily always the exact right thing I need. So I kind of went back into that aspect of, hey, I want to continue to build up strength so this doesn't happen again, but not necessarily the right strength
Yeah.
or the right muscle.
So also, let's talk real quick too about your working positions, because you said you work off of 3 different monitors. Is there one monitor that you work off of more
My laptop monitor.
in the center and down low?
Hmm.
Okay, is there a way to switch that monitor?
No.
No? You're a techie. There's no way to switch that monitor? What about getting it up higher? Like putting it up on a
Possibly.
box? What's
Yeah.
that?
I could look into that, getting
Okay.
it up a little higher.
So here's what we've got to think about, right? You've got a quick fix with the chiropractic care. It turned off some of the tone, okay? And there's nothing wrong with that. But then we have to continue to do some things that we think are going to allow us to continue to heal. So when we start looking at your patterns, you do a lot of exercise in the morning, which is fantastic. However, throughout the rest of your day, you're essentially sitting. Okay. So, even once you get better, you're probably better off to eventually move your workouts to later in the day. Okay. And that may not be very, conducive to your lifestyle. You may be in somewhat of a routine, but that's going to help break up that seated pattern. Okay. Versus getting it all in, all your standing, all your good activities, all the good compression and things that go on with the spine during a workout that are all really positive and have all really good physiological effects on it. All those things are eventually going to want, you're getting them all in right at the beginning, and then you're doing almost everything negative for the spine moving on throughout the day. Does that make sense? So when we start thinking about this even long-term wise, we might want to start thinking about how can you manage your daily activities in those positions of the spine, further on down the road, right? So the bottom line is what we look at here is we really look at patterns. So you do a lot of sitting, okay? And when we sit, the spine will actually flex forward. It'll compress the front end of the spine. And that is not necessarily a bad thing. It's just how much are we doing comparatively to kind of getting the spine upright and erect, okay? Even when you talk about your laptop, you might even try to put something in the small of your back from a lumbar support, okay? But if your laptop is sitting low and you've got any kind of eyesight problems and you start to lean forward and kind of squint towards it, well, you're going to all of a sudden take any kind of lumbar support that you were using or trying to use, and that basically nullifies it, right? Okay, so your spine is really on a more regular basis during your entire working day is bending forward, okay? About how many breaks do you take during the day? Or any?
I mean, I would not call them breaks, but I would say I get up. It totally depends on the day, but I would say I get up anywhere from 5 to 20 times a day and go to other staff offices or whatever. And so, yeah, I'm walking a decent amount, but it's never a break unless I'm intentional of stopping everything and doing it.
Okay, so my other question to you too is when you are then relaxing at home, you mentioned that one foot's on the floor, one foot is actually underneath your rear end.
That's just right now.
That's just right now. Yeah. Well, unfortunately, if we're going to be honest, right? Like if you're doing it right now, are we doing it later on? Probably. So what way is your spine more compressed? When you look at yourself right now, what way is your spine more compressed when you're sitting there? Like if you're right, or if your shoulder is closer to your hip, which side is that on?
Left.
Left. Okay.
Yeah.
Which side did the chiropractor say that was more compressed with the X-ray?
I don't remember. Hold on. Left.
Was it left?
Yes.
Okay. So that is quite indicative of how your pattern is actually going to be, our patterns are based upon our lifestyle, right? So habitually, if that's the way that we sit, then most likely you're going to appear that way just from muscle shortening on one side versus muscle lengthening. It doesn't mean that you're out of alignment. It doesn't mean that there's anything wrong with how the bones actually attach to one another and articulate to one another. It's just simply the fact that your body accommodates, and some of the structures on one side are going to become shorter in terms of the soft tissue and musculature, and some of the structures on the other side are going to be lengthened, okay? That's just how the body works, okay? So if this is how you're habitually kind of putting yourself into these positions on a regular basis, then your body's going to respond in that way. So we really need to start thinking about how we're positioning ourselves when we start looking long term, in terms of getting ourselves to be sitting more symmetrical, not leaning to one side, and that's just also when we're resting, right? So a lot of times when people come home, they essentially think that they've just kind of checked themselves out, and they mentally check themselves out, but then they put their body in kind of a crappy position. And therefore, they're really, even though they think they're relaxing, they're actually causing more of an irritation to that tissue, and therefore things just kind of continue to worsen, and the body doesn't have any type of break from that irritation. But right now, I mean, strictly speaking, when we look at your habitual pattern throughout your day and what may have given you, you got relief from the chiropractor, but then the symptoms came back and returned. The big thing that I look at is your spine is spending a lot of time forward flex in a forward bent position. Now, biomechanically, what we want to do to kind of counteract that is we want to monitor that. So right away, what I would tell you to do is we need to make sure that we are getting our getting something underneath the actual laptop. Okay, get it propped up, whether it's a box, whether it's a piece of Tupperware, I don't care what it is. Okay, but we need to get that up so that we can try to get your head backwards so that you're not getting your spine put into that forward flex position. One of the things that happens when we transition from a sitting to standing position, especially after sitting for a long period of time with the spine bent forward, is we get compression on that disc. That disc, there's a phenomenon called creep, which then kind of pushes the disc backwards. And then when we go to stand up, there's a lot of pain, pressure, and almost a initial irritation that starts to occur. So you're almost kind of re-injuring it repetitively throughout the day because you're sitting in a forward flex position. But ultimately, really what we're looking at here is we're looking at trying to find the pattern. So mechanical pain is essentially any type of pain that varies throughout the day. So even at your very worst, when it's constant, your symptoms get better and they get worse. All we have to try to do, and I want you to, so I've sent Heather a PowerPoint, and so on our PowerPoint slide, we can see really on slide number 6, when we're looking at mechanical pain, our listeners can't see this. We can see that I've created kind of a visual here of the pain and how it goes up and how it goes down. There's triggers and there's what's called healers. Where do you feel better, throughout your day? What's driving that pain down? Okay, and then that's going to be a healer. And then what is the trigger that's actually creating more pain? So right now, as you sit more, your pain gets worse. Okay. Now, periodically, when you've been standing up, especially in the morning, there's some physiological, biomechanical reasons why people have some oddity in terms of pains in the morning. So we're going to kind of separate those things out. So that can be a little confusing for people. But as you get past maybe hour 2 of your morning, what we're really looking for is what's making the pain worse and what's making the pain better. So for you, it's actually pretty clear your injury is basically driven by a repetitive bending, and then your pain is actually driven throughout as it's continued to come back, is driven with repetitive bending forward or static bending. You're very fearful of actually picking up anything off the floor, those types of things. So what we need to do is we really need to try to get your spine into an extended position, it sounds like, and try to monitor that. So we've got to look ergonomically, because I think that's where, let's say that you were, who knows, a nurse, maybe not doing a lot of lifting, but doing, up and down quite a bit and not sitting quite as much, breaking up your daily patterns. I think you probably wouldn't have had this reoccurrence. But the fact that you're sitting for 8 hours, and some days you may be only getting up 5 times a day, and some days you may be getting up 20 times a day, I think for the most part, this is probably due to the repetitive sitting and then kind of your poor posture while you're doing that. And I've worked with you before, or I shouldn't say I've worked with you before. I've seen you out and about, and we've had coffee, all that kind of stuff. You constantly put your foot underneath your leg, and you're constantly leaning forward, and your posture, unfortunately, is really poor. So I think that's probably one of the big drivers. You knew that, probably. What's that?
I did, and as you talk, I'm 5'10", 5'11", and so even in my kitchen when I'm cooking, all the countertops always, no matter where I'm at, seem low.
Mm-hmm.
And I favor my left side. I'll constantly shift towards my left and put the greater amount of weight on my left foot, even when I'm standing at the stove or whatever.
Mm-hmm.
And then I am always in this slightly forward flex position as I'm over a counter or sink washing dishes or whatever, just sometimes because of my height too. It's just a natural. I'm assuming that it makes it more natural. natural.
It does. And, the ultimate thing is like I have a student right now and I keep telling her constantly, like we went through a low back evaluation yesterday and it was not a very clear cut evaluation. And I told her and she just kind of, we have a signal that says when she's sinking, when she needs help. And she was like immediately sinking throughout the evaluation. And so as I was talking with her afterwards, I said, this person wasn't clear cut and your symptoms aren't, quite obvious. Some of them are, some of them aren't. You're kind of in between because there are sometimes you do get a little bit of relief. But ultimately, this comes down to how do you spend your day? And when the majority of your day, like if you are, this is something I tell people all the time. If you, are continuing to hurt, if you were feeling better and then your symptoms come back, okay, why are they coming back, especially without an incident? It has to do with your habitual patterns. It has to do with how you're spending the day. If you were doing things that were correct, if you were doing things that were right, okay, and there was, there wasn't a specific incident that agitated this, right? Mm-hmm. You wouldn't get worse again. Okay, so we have to kind of dive into how you manage your life, how you manage this positioning of your spine in this particular case. So you really, like for you, ergonomics is huge. You got to get your laptop up. If you do spend time more on one side versus the other looking at a particular computer screen, you've got to look, you've got to try to center whatever computer screen it is and either get a rolling chair and actually roll your chair and so that you're not twisting. We had a microphone malfunction here, folks. So we're not twisting and we're keeping everything centered and we're keeping everything nice and symmetrical. The other thing, though, is, and I can email you these, is we need to start doing, even if you're not able to get up during your day, we need to start doing some extra back bends. Okay. And then we also need to. You cut out on that last part. Can you repeat yourself? Oh, yeah. So we also need to try to get you to do some exercises throughout the day to try to counteract some of the forward flexion. So we're going to want you to do some back bends probably in your seat. And then some make an excuse to go to the copy or make an excuse to go to the restroom, drink a bunch of water, whatever it is, make an excuse to get up more. Okay. Walk more, maybe standing back bends. But what I'll do is I'll print you off a little bit of a plan, that you can, some exercises that'll help kind of get you established. And I think ultimately really this is about the spinal positioning for you. And that's something that okay, but ultimately this is too much of one direction and not enough of another. Okay, and not executing it enough, even if someone like what the chiropractor just give you strengthening exercises, or did he actually give you stretches?
He gave me some stretches to do, but as far as like strengthening exercises, he told me he was going to, then he didn't. So
what were the stretching exercises?
Gosh, that was a long time ago. Is that more of like the gentle rotation and then just kind of the standing up and extension, just keeping things mobile, mainly just on the back though. The gentle rotation side to side was one of the bigger ones he gave me, I would say.
Yeah. I mean, what we can do is we can follow up with you and see if we need to actually add like a side stretch. But what I like to try with people first is just get them on a heavy dose of the extension where they're really doing it 1 to 2 times basically 5 to 10 times every 1 to 2 hours. Okay. And basically go through those exercises there. Okay. So either sitting in the chair with the back bend, and again, I can email these to you, or standing back bends, or there's a wall back bend exercise that I like to give people to. That's a nice transition if you don't tolerate doing them straight in a standing position. And then also there's one that you can do on your stomach too. So I'm going to send you all those with the repetitions that would be recommended. Okay.
Okay.
All right. Good. What other questions do you have? Anything else that you think I need to know? Anything else that we didn't talk about?
Not that I can think of, although you know some of my history, so if there's stuff we haven't talked about.
Sure. All right. So I think that kind of wraps everything up with us here today. What we would typically do for a follow-up, and maybe we can even do this for another recording, but what we would typically do is ask somebody to come up for a consultation and kind of see how the exercises are affecting them. The things I want you to think about, though, is when you're doing your exercise and when you start being consistent with it, how is it affecting your pain? Okay. Is it making the pain closer to the spine? Is it making the pain move further away? One of the things that's important to understand here is that we want the pain to actually be closer to the spine. We don't want it to be radiating out to the flanks, out to the sides, and or down into the hips, bilateral hips or buttocks, okay? So even if you have a little bit more intense pain when you're starting to do some of the extension exercises, it's okay. That's perfectly fine. But if you're doing the exercises and making pain radiate out or down, that would be a negative. Stop them until you can kind of contact us again. But what we would anticipate is that some of that pain may actually increase or pressure may increase in the lumbar spine, low back. That's all okay. So don't be too worried if that's the case. And really try, and if you are having more pain as you're sitting for longer periods of time, really monitoring your posture, put a lumbar roll in the lumbar spine there. But make sure that if you are having pain with that, then get up and move. Don't try to get into a forward flex position to try to give yourself some relief. Okay?
All right. One of the other things I thought about, because I know you and we've been friends for a while, I have one of your invertibelt thingamajiggers. Is there any exercises with that at this point, or just more of the biomechanical exercises?
I think there could be something for you. But let's talk about that. We'll talk about that off air. I mean, if this were just a strictly live demonstration, like we're kind of, planning it out to be here, I wouldn't be trying to push the belt on somebody. But I think we could probably talk about that off air. And you could probably use, there's some ways that you can use that and maybe you benefit from that too.
Okay.
Okay.
All
right. Cool.
Alrighty.
All right. Anything else that you need, contact us. Obviously, you have my text, but normal people would just contact us via an email address, which would be Will, go.
DIYtherapy206@gmail.com.
Way to go, Will. All right. So it's been fun, Heather. Keep us in the loop, okay?
Okay, sounds good. Thanks, guys.
All right.
Thanks, Heather, for sharing that with us and being willing to participate in this demonstration of a wellness consultation. If you would like to sign up for a wellness consultation, you can do so at DIYtherapy.net. We will check back with Heather to see if she is any better or worse or the same in a couple of weeks, and if she is following the protocol that we recommended with the extension, which is hopefully going to improve her back pain. We'll wrap this up. This podcast was for educational purposes only. It is not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professional prior to beginning. Information on this podcast is not designed to replace medical treatment. Remember, treat yourself.